everyone. This is Deanna Minnick, the host of the Detox Summit, where you're going to learn the facts about toxicity and detoxification. And today I'd like to welcome you to our interview with Dr. Joel Kahn. Now, you may already know who Dr. Kahn is. He is a superstar in the area of cardiology. He is, some people have referred to him as the Dr. Oz of Detroit. And I would say that there's probably some truth to that, especially with the launch of his new book, The Holistic Heart Book, and all of the great work that he's been doing in integrative cardiology. So for those of you who do not know who Dr. Kahn is, he graduated from the University of Michigan School of Medicine. He's a clinical professor of cardiology at Wayne State University School of Medicine, and he has an active, thriving, bustling clinical practice. And his website is www.dr, which is drjoelkahn.com. Now, you may also not know this, but he's the first physician to be certified by the University of South Florida in metabolic cardiology. Isn't that a very interesting combination of words, right? Metabolism and cardiology. So he's the author of over 150 medical papers and book chapters, just came out with his book this year. Again, it's called The Holistic Heart Book. So welcome, Dr. Kahn, to the Detox Summit.
Well, thank you very much. I feel like that amazing introduction was a detoxification procedure. I'm smiling big.
Sounds great. So, Dr. Kahn, on your book, I was, first of all, this is a gorgeous book. I compliment you. It's not only beautiful, but it's chock full of wonderful information, very accessible, easy to read. And I noticed a couple of things about what you were speaking to as it related to toxicity. So even on the back of the cover, it says, drink your veggies, sit in a sauna, walk barefoot to a healthy heart. So I'm just curious about that phrase, and maybe you can just expound upon that a little bit for us.
Well, in terms of the topic of detoxification, there is a good, solid scientific basis that the first thing mentioned, regular intake of leafy greens, maybe particularly cilantro and the darker greens, kale, will support liver detoxification. And it's a pretty good strategy if you're a juicer to be throwing a rotation of dark leafy greens in your juice, or if you're a whole food eater or a smoothie, a blender maker person, also incorporating those in your food. Just a great strategy. There may be something special also about chlorella, spirulina, blue-green algae for detoxification, if you can sneak those in your diet. Infrared sauna in general, sweating is an interesting process, but it clearly removes toxins from the body, heavy metals from the body. You can measure what's in sweat, and it is not the same constituents of your blood. It actually has some extra concentration of toxins. And there is particularly a type of sauna called an infrared sauna with a surprisingly large amount of data in the cardiology world, particularly Japan, that it's a detoxification strategy. I've had the luxury of having one in my bedroom for a little more than a year, and good and hot and dry. And that sweating process, again, is very special. It probably applies to other forms of sweat, as in exercise, yoga, and such. And then apparently I need to take a brain booster, because the third comment besides sauna veggies was walk barefoot.
Yes, walking barefoot. Now, what does that have to do with the heart?
Yeah, I can't swear that there's any data that walking barefoot is detoxifying. It's based on a theory with some scientific support. We need more, that the Earth is an electronic and electron-rich planet, that we've robbed ourselves from our former frequent connection to actually the physical substance of Earth, dirt. Because we wear rubber-soled shoes that are insulating, we sleep in houses that insulate us. We don't sleep on the floor in a cabin anymore. We don't walk barefoot or in leather-soled shoes like we used to, and that we've suffered some. So there's some data that being barefoot on grass and other strategies called earthing or grounding are anti-inflammatory. There's some data that they prevent blood from coagulating, thickening. They reduce the viscosity of blood. I'd like to see more science, but I thought there was enough to throw it in the book. And again, in my own home, I have a grounding sheet at the foot of my bed, so I'm connected through the socket to the ground and earth, and similarly in front of my computer. And it's about as new age as I get. because that's as I say, an area that we need a little bit more work on in terms of science.
You know what's interesting about you and what makes you so unique relative to other cardiologists that I know is that you really walk the talk. So you just mentioned that you've had a sauna for the past year, which is great. I have one too. I love it. You do yoga. I follow you on Facebook, and I note that you post some research and also your experience with yoga. And you're a vegetarian, right? So, well, actually, you're a vegan, aren't you?
All true.
All true. So, wow, hitting on all those cylinders, you really do walk the talk of protecting your heart. And as you even stated in your book, you're a preventative cardiologist, really looking to be sure that people don't end up with cardiac events and different types of issues, right? So, perhaps you can speak a little bit to what toxicity has to do with the heart. Why would I be interviewing somebody like you, a cardiologist, about toxins in the heart? Because usually when we think of toxins, we think about the liver, we think about the gut, all the organs of getting those things out. But what does the heart have to do with toxins?
Yeah, and it is a good question. And I think on standard medical school curriculum and standard conferences, you'll see very little about it until just recently. And that's a plug to remember to talk about the TAC trial. But probably the strongest foundation is in the field of heavy metal toxicity, and that's predominantly mercury, lead, and cadmium. That most of us are familiar with these as potential environmental risks. Gas going from leaded to unleaded 25, 30 years ago, paint going to unleaded. But, we buy cadmium batteries, don't think about it. But the fact of the matter is that no matter how careful you are, there is lead, mercury, cadmium, and other metals in the environment, in our water, in our air, in our soil, in our food. And almost without exception, we've accumulated small, medium to large amounts in our body. Particularly lead likes to hide away in bone and can be very much incorporated into bone structure. None of these metals have any physiologic function that's good. There's no minimum amounts we need, and they're only poisons. They're only toxins. They interrupt enzyme function and mitochondrial function. And we know quite a bit about them as toxins, and we know quite a bit about them as particularly cardiac toxins. So the link, for example, of mercury overdose acutely or chronically and high blood pressure is well known. Cadmium and lead and such can interfere with mitochondria and cause potentially congestive heart failure. There's some really interesting data that there's a cardiac issue called a cardiomyopathy, a weakening of the heart, and that if you measure in the actual muscle of a patient with a weak heart, the amount of heavy metals in the muscle, perhaps they're having a biopsy, or perhaps their heart is coming out as part of a transplant, that there can be 50 to 100 times and maybe even more concentration of these abnormal substances in the heart of people with cardiomyopathy. And, we have a large group of people that we call idiopathic. We don't know why their heart's weak. And I believe at least a good number of them have this issue with heavy metal. But it's not so easy to check. It's not routine to check. And you obviously can't diagnose something you're not testing for. So heavy metal toxicity in cardiology and high blood pressure, I think should be more part of the standard fare. And the tests are available. And as we can talk, there actually is treatment. So it's not like a nihilistic activity that would make a diagnosis with no specific therapy.
Right. So you're really making a very good case for all of these metals being involved in some way in cardiac concerns, even something as common as high blood pressure. So everything you said is just so insightful, and it just makes me think, why aren't more cardiologists assessing all of these different heavy metals? And so I'm just curious, are there easy ways to do that in the office? And if a patient comes to you with hypertension, they have high blood pressure, are you looking at metals in any way, or are you accommodating for that? Are you investigating to see whether or not they have exposure to heavy metals in their environment?
Yes, and it's a good question. The one that's easy to do, you can get blood levels as a heavy metal screen, and you can also get a urine heavy metal screen, and that usually will be covered by insurance, even with a diagnosis of high blood pressure, coronary artery disease. The problem is those are acute levels, what they are right at that moment. And typically, other than environmental exposure like workers in foundries where they might get a very high dose all of a sudden, most of us are getting very small amounts, eating fish, having silver fillings and such, very small amounts day after day after day. And the blood level is not very dramatic, yet the stores in the body can be quite substantial. So blood testing is the most widely available and in an insured system, the most pleasing to patients, but it is sometimes lacking in really providing insight. The best test seems to be to get a 6 or 24-hour urine collection at baseline, then give one dose of an agent called a chelating agent, usually DMSA. It's an oral substance pill that's well tolerated, and then following it up with another urine collection for 6 hours or 24 hours. So you have the baseline, then you see how much it comes out of the body with provocation. And when that's done, you can see some very surprising loads of heavy metals and make a diagnosis that they may be part of the blood pressure, the congestive heart failure, even the coronary artery disease syndrome, including chronic kidney problems. There's quite a bit of data that these metals accumulate in the kidneys and participate in progressive weakening of kidneys, which is just an awful disease.
So now you mentioned the process of oral chelation, which can be very taxing for many people. It requires, they might have some side effects of that procedure. It involves dosing over a certain amount of days, and, it's pretty rigorous. And so I'm curious, do you think that people can do detoxification in a less rigorous way, but also as effective as chelation? So in other words, going back to some of the things that you talked about before, doing the green smoothies, doing the sauna, making sure that you're not having the degree of exposure to toxins. Do you think that everybody with toxicity has to go through oral chelation practice in order to remove those toxins?
No, and to answer your question, I think all of us, and that's what this summit is, of course, doing, need to increase our awareness of the potential problem and incorporate, hopefully, some simpler day-to-day strategies. And whether they're effective or not will be a little harder to judge, but they're going to reach more people. So being aware that fish is a source of mercury, and large fish, particularly eating shark steaks and large tuna steaks, may have highly concentrated sources of mercury. Or, as we saw an actor about 6 years ago, Jeremy Piven, just went on a sushi binge, and probably pretty high quality fish, but just the volume of raw fish provided him such an excess of mercury, he went to the emergency room a few years back. Being aware that that's an issue, being aware that there is substantial data that a mouthful of silver fillings are 50% mercury and could leach some mercury in the body day after day after day. Thinking about new fillings not being silver amalgams, and even considering finding the proper dentist, a biological dentist, to replace the silver fillings with composite, non-mercury laden fillings, things like that. But yes, eating daily high loads of green leafy vegetables and smoothies and salads, cilantro, spirulina, chlorella. I know you and I will agree that those are the core of good foundation, no matter what your goal is. Organic, particularly, it wouldn't make much sense to want to detoxify with a green smoothie and pick produce that's probably quite rich in pesticides and organicides and stuff. So you're going to have to switch your buying habits over to organic produce to really achieve that goal. Yes, sweating regularly, whether it's through exercise, through wet heat, or if you can find in your town a wellness center that has an infrared sauna you can rent for 20 minutes, or even look into buying them. There are some portable, smaller units that are well under $1,000 and do the trick, even though they may not look like your typical sauna. Being well hydrated and household purifying systems, reverse osmosis systems, is just as important when you shower and bathe that you have purified water because of the skin's absorption as it is what you drink. So, going through all those processes, taking chlorella tablets on a regular daily basis is a pretty good strategy. Good data that they have some activity in reducing heavy metal burdens. They were given out in Fukushima after the reactor exploded because they may also increase radiation resistance. These are all the day-to-day, and I really stress again, organic produce, kind of following the Dirty Dozen, Clean 15 guidelines would be a good strategy.
Wow. You just gave us a laundry list of many different things that we could do to definitely detoxify, and many of those can be incorporated into our everyday lives. So we don't have to necessarily think about oral chelation unless we might have some more chronic condition that warrants that degree of rigor when it comes to detoxifying. Dr. Kahn, one of the things that you said that really got me thinking, especially with you being a cardiologist, is you were talking about fish. Now, we know that fish contains an appreciable amount of omega-3 fats, and omega-3 fats we know are anti-inflammatory, and we don't get enough of them in our diet. So I thought that the message was out there for us to be eating more fish so that we get more of these omega-3s. How do we reconcile that with what you're saying now about all of the toxins that are found in fish?
Yeah, and it's a challenge. And as the listeners may know, there have actually been a few chinks in the metal of the omega-3 story in the last year, with several trials not being and meta-analyses, large grouped measurements of some of the data not being as supportive as we previously had thought. But I think most of us aren't ready to abandon the general idea that an omega-3 rich diet, and I'll include that, has to include walnuts, chia, flax, algae, and even, again, green leafies. Kale is pretty omega-3 rich. We're not giving up on that concept at all. I have to acknowledge, because I do a lot of lectures as a vegan cardiologist talking about data for the heart, that when you look at the Adventist heart study out of Loma Linda, one of the best pieces of cross-sectional data, the people that were vegan but ate fish, whatever you want to call those people, actually had slightly better survival over 20 years than even the vegans without fish. So I have to be authentic that the data, at least certain pockets of it, say fish is very healthy. But then we got the other reality that the oceans are polluted, and factory farming is typically an abysmal, genetically modified, rich, pollution, rich source of food. And I wouldn't encourage anybody to go there, with rare exceptions. I think there's a company called Black Pearl that is a factory farmed, very high quality source of fish. So we tend to talk about small fish, and we're back to talking about sardines and herring and anchovy and good quality salmon that you can really investigate where you're buying it and be pretty sure that it may in fact be labeled mercury free. You have no idea if it's DDT free and dioxane free and BCP free and the rest. But being a bit of a snob, a bit of what Dr. Mark Hyman says is a qualitarian, spending a little bit more, eating less. So I'm very honest with my patients that fish may be a good component of their diet, but I would like them not to buy it at the gas station.
Yes, that definitely is great guidance. And so thinking about all of the issues with fish, the contamination of fish, the fish supply. And so what I was hearing you say was that we need to be shifting perhaps towards the vegetable sources of these omega-3s. So one of the things I wanted to ask you though is, a lot of the vegetable forms of omega-3s are not the same as what we find in fish. And do you think that everybody will be okay with the conversion of those vegetable forms of omega-3s into the longer chain fats that we typically find in fish? Is that an issue for us to think about?
I think it is an issue, and you're probably slightly more expert on that than I am in terms of the desaturated steps and such. But it is pretty easy now to measure omega-3 index levels in red blood cell membranes. It's not a standard panel necessarily in every office, but it's clearly becoming more frequent. So the bottom line is, if you're not sure if a patient's getting enough via their chia and their walnut and their algae-based, there is a blood test, and if it comes back fine, I think you can conclude that is the case. So I am finding that a lot of my plant-eating patients are a bit low in their omega-3 index, and we're adjusting their diet and making recommendations, and 6 months later it's coming back much better. So I think it's a solvable problem.
Oh, that's great. That's good to hear. So being that what I'm also hearing you recommend and advocate is eating more organically grown food. And I know that for many people, what I hear back from patients is that organic is expensive, and can't we just wash our food really well? And I also remember reading a statistic that even 30% of organic food is contaminated with pesticides, insecticides, and herbicides. So I'm just wondering what your thoughts are on truly eating organic. We know about the environmental working group Dirty Dozen and Clean 15, but does it really make sense for the pocketbook to be eating organic? What's your stance on that?
Yeah, I'm a strong advocate, and I do ask my patients to, for at least those 12 produce items, to spend the money. And we have again recent data, at least a suggestion out of England, that an apple a day is as powerful for cardiovascular prevention as a statin a day. And we're not eliminating medical therapy by apple therapy, but it's a pretty profound statement. And here we find out that we really have to buy organic apples to avoid an unbelievable load of toxins. So I do recommend that my patients follow that 12 preferred organic produce. It again makes no sense to me to be juicing or loading up on vegetables when indeed they may be just coated with all kinds of a variety of chemicals that are harmful to the body. And I think it's worthwhile to spend more, eat less. You can run, but you can't hide. So that your statistic that about 30% of organic produce still can have measurable contaminants is a sad testimony to the water supply and spillover from other adjacent farms. So again, you can't hide, but you certainly can manage and control.
Yeah, you can manage for sure. And one of the things that I talk with patients about is washing their fruits and vegetables when they get home from the grocery store. Some of the hardier varieties, like an avocado, as an example, because otherwise we track a lot of that stuff within the house. So and that lives within our kitchen. So even if we do have food that is contaminated, despite the fact that it is organic, that we can make sure that we're taking the necessary precaution. So it's almost like eating is like a full-time job in some ways, right? Especially considering that we interact with food and eating on the order of something like 200 times per day. All these
Yeah,
decisions that
I
we make.
do feel you do need some sort of food PhD, which you have, and I have some more knowledge than I had in the past to get through this crazy world of ours. And, most are not even aware of the problem, let alone know where to look for the information. So thank you for having this kind of summit. But it would be a better world if we kind of could return to simple farm to table kind of situation that existed 50 to 70 years ago. But I think that's never to be seen again.
Right. Yeah, it is challenging. And I'm even thinking of the one line in your book, which was more than 80,000 chemicals are used to make common products we all use daily when cooking, cleaning, and caring for our own bodies. So it's almost like what you're saying right here, it's almost inescapable. We've got all of these products. We've become a very commercial society. And one thing I did not hear you mention, but I'd like for you to talk about it if you can, is the use of personal care products. So things like lotions and creams. You already mentioned that the skin is something that we absorb through. So the skin is not just kind of just sitting there, it's very active. So are you concerned about personal care product use by your patients?
Yeah, I am. And again, I try and keep my attention focused to cardiology, but there are a number of products and personal care items that are now known to either be xenoestrogens that act as if they were estrogen and that may have unfavorable effects on cardiovascular function and prostate function and prostate cancer risk. And then the endocrine disruptors that are potentially affecting the thyroid, all the antibacterial soap in my hospital. I check every time I walk into a restroom or a surgical area. It always has triclosan, which is pretty much recognized now to interfere with thyroid function and potentially other endocrine organs. Phthalates and plastics that are in creams and lotions. So I think it's important for people to recognize, again, that we've swung this pendulum so far to the side of a crazy world full of toxins. And there are, fortunately, the industry is responding with nice options. So there's not a personal care use item or a home item that doesn't now have multiple manufacturers. And you got to be a little savvy just because it's in a green label or says it's a green product. So you have to go, again, find a reliable source. I do tend to return to the Environmental Working Group website for my updates on that area, and I think it's still considered a pretty reliable place to go.
Yeah, I would agree with you. I think it's an excellent site. It gives a lot of great information. One of the things that you just said there that I'm not sure that all of our listeners will be aware of is this term that you just used, which is endocrine disruptor. Now, I've heard Dr. Bland and others say before that the heart is a neuroendocrine gland, that it by itself is an endocrine functioning unit. So I'm wondering if you can explain just in really simple terms, what is an endocrine disruptor, and is the heart an endocrine organ? And how do we navigate our way through all of these endocrine disruptors that are out there then? What would be kind of your general takeaway as it relates to the heart?
Yeah, two different kind of areas to answer there. The heart is an endocrine organ. About 30 years ago, a hormone that is made only in the heart, atrial natriuretic factor, atrial natriuretic peptide, was discovered, and it is now understood to control blood volume and congestive heart failure function. However, to my knowledge, some of these external chemicals and environmental stressors do not affect the endocrine function of the heart. But it is an endocrine organ, and it's a neuroendocrine organ because there are many neurons that both reach the heart as well as neurons that start in the heart and reach the brain. But the other aspect, so, the endocrine disruptors is a term that most of us haven't heard until the last decade or maybe even 5 to 6 years. But they are chemicals in the environment. I mentioned some of the biggest ones. I didn't mention bisphenol A, BPA, and there's a sister compound, bisphenol S, BPS, phthalates, triclosan, azartine, and some other products out there that seem to impact maybe predominantly thyroid function. Now, that does circle back to the heart, because if you have sluggish thyroid function, it does affect cholesterol metabolism. It's been linked to increased risk of hardening the arteries and such. So indirectly, all those products have a cardiovascular ramification, which is somewhat scary. And then, the plastics affecting, again, the xenoestrogens, the tremendous number of hormone mimickers that are out there due to industry environmental toxins, and what impacts that's having on male testosterone levels, estradiol levels, and such from exogenous sources, let alone, we're all dealing with the fact that we have the potential to live longer, and menopause and andropause or menopause. These are all issues that affect our potential to age gracefully and maintain our function. But now we have all these external factors, including endocrine disruptors. But it is very simple, not to discourage, the listeners, to get some knowledge and make some quick substitutions that will address a good portion of the problem. Making your kitchen a holistic kitchen, making your bathroom and your garage a bit more of a holistic part of the house, and your shopping cart a bit more holistic, and that's going to take care of a lot of the risk.
Yeah, I would agree. That's really good feedback. And thanks for defining what an endocrine disruptor is. And you mentioned that, we can really take care of a lot of that. We have the locus of control. We start with our house. And in your book, you do talk about the home a lot. You talk about these power prescriptions, and you talk about ecoizing your home. And what was really surprising for me, so if we just focus on air right now and think about pollution, I know that there are studies that suggest that when you live in polluted cities, that these particulates in the air can be associated with cardiovascular disease. Can you speak to that a little bit?
Yeah, that is really an interesting, and maybe we want to even say distressing topic, but one that can no longer be ignored. There are dozens, I think there's well over 100 studies now that link, secondhand smoke, we all recognize is a real issue and detrimental to both lung and cardiac function, and to be avoided at all circumstances whenever possible. But that you can control, and you can control walking by a bus and a truck and breathing in dark soot. But it's that vague haze that we all live around, or at least some of the time is around us, this microparticulate matter, small little particles that may come from automobiles and trucks and factories, and just the wind stirring up the dirt and such, that there is a clear link that when you measure air quality, you can find a connection to increasing rates of cardiovascular issues and death. Very scary. The example that I mentioned in my book, which is just so fascinating, is the 2008 Olympics in Beijing, China, very factory dense part of China. And for about a month before the Olympics, they generally turned off all the manufacturing to improve the air quality. They were aware of how bad the air quality was. And a couple of weeks after the Olympics, they turned the factories back on. So it was about 6 weeks with a difference in air quality. And they had scientists there, and they tracked that admissions to hospitals for respiratory problems, for heart attacks, blood pressure, and other measures of inflammation. They did some actual science on it, all improved when the factories turned off, and all returned to baseline as soon as they turned back on. So that's just one piece of, they say, a large amount of data. And some of it is just common sense and trying to avoid, at least recognizing that if you're walking in dense, heavy traffic, you might try and find another path. Getting in green areas as much as possible for exercise, for peace of mind, and the rest. And then maybe an air filter in the house. They have been quite effective. It may take 1 or 2 air filters to cover all the square footage of your house, but they really do remove a large amount of the particulate matter in the air. Kind of hard to test the effect because there isn't a simple home kit for it all. But it's something that I do recommend that people learn more about. I just feel bad for people that are trapped in areas. I have one job. It's I'm in Detroit as we're talking, and we have a lot of factories still producing and petroleum manufacturing. And there's one area that the air is every day just so thick as soup and sulfur-ridden and rest. And there's no question it's detrimental to both heart health and general health. So protect yourself. Wear a mask if you need to.
Mm-hmm. Good advice. One of the things that you mentioned in your book that I had been aware of as well and had really been thinking about this is that, you're describing a lot of outdoor air instances, and you did talk about the home a little bit about getting a filter, but I'm hearing more about this idea of indoor air pollution. So does that mean that even if we're indoors at a job or at our home, that we can be getting as much pollution as potentially there is outside, or are we somewhat protected? Because I know you addressed this.
You're absolutely right that there can be higher levels of airborne toxins and particles inside a workplace, certainly a factory setting, obviously, but even a seemingly clean one, a seemingly clean home environment. I'm sitting in a hospital office that you wouldn't suspect, but industry has changed in drywall and adhesives and carpet manufacturing and furniture and upholstery manufacturing and paints and the rest. They may no longer have lead in them, but they are eluting different airborne particles and sometimes very high density of airborne particles. We all may know or have heard of a story of a family that moved into a new house and had health problems and actually had to move out. I know several such families where that's happened, and it may have been the carpet and they had to put in wood floors and such. So actually one strategy is when you can and when the environment allows is to open your windows and air out your house. We bring in dry cleaning. That's something I do mention in my book. And dry cleaning is generally a extremely solvent-rich, chemical-rich practice that most of us do from time to time. And it comes right from the dry cleaner right into our closet. We take the plastic bag off, and you can measure higher levels of airborne solvents that many of them have been linked to health issues for a number of days. And some people recommend leaving your dry cleaning in the garage for a couple of days to degas, or actually trying to find an organic and sort of green-based dry cleaner, or wear organic cotton clothing and don't dry clean it. There's a number of strategies, but the house can be quite a toxic zone, including air pollution.
Yes. And I'm glad that you did mention the air filters. And, you have to look at square footage of your home to see how many air filters you might need. I remember reading in your book that there was a study that you cited talking about how when air filters were used in the home, at least in this study in Denmark and Sweden, that there was an improvement in the functioning of small blood vessels. So to think that our blood vessels are so sensitive to these air particulates, and that could affect our circulation, our blood pressure, so many different things. So it's kind of interesting, isn't it, that we have that interconnection?
Yeah, I mean, again, I'm interested in it as a human living on planet Earth, but as a cardiology specialist, the data that particulate air matter, i.e. pollution in the house or outside, causes inflammation of our blood vessels, causes dysfunction of our blood vessels, causes platelets and white cells to activate, causes even part of our nervous system to be less efficient. It's quite a strong database that all that happens, and it's just no longer a factor that can be ignored in addressing, again, in a holistic manner, improving your quality of life, hopefully your quantity of life in a good manner.
Exactly. Well said. So we've covered a lot of ground here. We talked about fish, we talked about saunas, we talked about organic produce, we talked about air quality. Now there's one last toxin that I can't help but just get your take on. And it's one that probably you and I both have some passion around, and that is sugar. Sugar in the heart. I want you to perhaps speak a little bit to the effects of sugar as a toxin as a cardiologist, and you thinking about all of your patients with cardiovascular disease. I know that there was an article published, I believe it was in JAMA just a couple of weeks ago, talking about the intake of added sugars and the incidence of cardiovascular disease. Do you think that there's anything to this idea of sugar is toxin for the heart?
Well, number one, very interesting question. And historically, there has been a bit of a debate among some of the most eminent epidemiologists. Is cardiovascular disease most strongly linked to animal saturated fat? That's the Ansel-Keys theory, which I believe is sugar perhaps more strongly related to heart disease. That's the John Yudkin theory, which I think is much weaker. And sugar hasn't been a major focus for the past 50 years of cardiovascular therapy or prevention. But I think it's that famous statement, something like the dose is the poison. I mean, we have so much escalated in the past 50 years, processed foods, fast foods, the drinks that we carry around with whipped cream all over them, and 1,000 other examples. So the quantity of sugar that is in our diet, processed white sugar, particularly our children, is so phenomenally higher that I'm not sure if it's the dosing of the substance. But I think it is no longer possible to conclude that sugar is innocuous. You're right, that article, there was one last year that even a single sugar soda pop a day, let alone people who might drink 5 or 10, but a single one a day raises cardiovascular risk. Well, how it's linked to obesity, how it's linked to other eating habits, the fast food, processed food industry so often links sugar, salt, and fat in one tasty morsel, so it may be easy to measure a very high sugar level, but it drags along with it fat and salt and other chemicals undoubtedly. But I think the call to be aware and to reduce processed sugar, processed food, soft drinks, I think there's general agreement that this is the proper place to go. And it's a matter, again, of changing buying habits in the grocery store and what you stock in your pantry, your freezer, your refrigerator, learning to enjoy green tea. I didn't tell you 10 years ago how much a fan I was of that, but that's my go-to drink. I've got a cup of it in a paper cup in my hand right now. I think sugar's a problem. I think it's not the main problem. I still, in my own analysis of cardiovascular disease, heart attacks and such, James Gandolfini, who died last summer tragically at age 51, ate a enormous fat-laden meal in Rome and then had a sudden death heart attack. I don't think it was because he put one sugar packet in his espresso. I think it is still animal saturated fat in gross excess over time equals atherosclerosis. And sugar, its exact mechanism, I think, needs to be worked out, but it will stay on the map of something that we're advising patients to become aware and reduce.
That's great. I am really glad that you brought up the idea of fat, dietary fat, because that's probably the more logical link that many of our listeners are aware of when it comes to cardiovascular disease. So what was brought up in the 1950s, the Ansel-Keys work, and then really looking at the amount of fat, even in one meal. I've seen that we can provoke this, what we would call endothelial activation, or where we get this whole cascade of inflammation going within the blood vessels. So, and I've often wondered, though, is it because of the fat, or is it because of maybe the pesticides, insecticides, or other contaminants that are in the fat? Because as you know, Dr. Kahn, that's where the toxins like to reside, is in the fat. So do you think that perhaps what we're looking at when we're examining the role of dietary fat in cardiovascular disease, that any part of that might be related to the degree of toxins that could be in that fat?
It's a good and very challenging question. I mean, one thing I think that's been looked at, because I've read most of the studies about an acute meal and endothelial or artery damage, of which there's probably 20 or 30, it's not sugar. And we just mentioned sugar. So you can give a person a large glass of orange juice with a very large glucose load, and it will not cause endothelial dysfunction. So, as we just spoke about, if there's a link between sugar and heart disease, as the new data in the past few years suggests, it may be through other mechanisms, but not through immediate endothelial damage. But if you give pure cream or any of the processed foods that we can talk about, an egg McMuffin and a burger and a fries and a hash browns, it does happen. I think it's predominantly the animal saturated fat. I think it's that. And it may also be that when you're eating poor quality, cheap processed food, as you know, there's often quite a big load of endotoxin. There's dead bacteria. Can't get rid of them if you irradiate them, if you boil them, if you put them in acid. And along with those dead bacteria come the chemical lipopolysaccharide or endotoxin that damage arteries. So I think it's a complex mix, and the content of animal saturated fat may be the best marker and may participate to some degree, along with, like you say, these are not animals that are living outside the world. They also are accumulating PCBs and dioxane and DDT and all the other joyful things we find in newborn babies. So the best is to, in my view, limit animal products and, again, search for quality, search for reliable sources, and spend a little more, unfortunately.
That's fantastic. Well, it looks like we're at the close, and you've just given us so many great tips and all of your recommendations. And again, what I really like about you is that you follow these recommendations. You are definitely putting them into motion, and you're very healthy. And you really are the living proof that much of this can work. So, do you think that you can summarize for the listener what are the top three takeaways from everything that we discussed? If you just want them to remember three things, what would they be?
I think you really got to strive for clean water, clean air, and clean food. And one, recognize the problem, and two, find some usable solutions, which for most of us are really just changing maybe a dozen habits. And we've talked about most of those today. So, think about your home water supply, and think about plastic water bottles, and think about leaving plastic water bottles in your car when it's 90 degrees and what's happening there, and microwaving and plastics. But clean water, clean air in your house, open the windows, think about a home air filter, think about your dry cleaning, think about walking in areas that are dense urban and strategies to avoid that. And then we've talked a lot about clean food, and the solution currently is spending a little bit more, reading labels, finding farmers markets, and buying organic produce. I think it's going to get easier. I think the consumers are getting much more knowledgeable and much more involved in this process, and the manufacturers are going to respond. So I think we've hit bottom, and we're actually bouncing up a bit.
That's a hopeful message to part on. I want to thank you so much for your time, Dr. Kahn. And just for our listeners, I want to repeat that Dr. Kahn has two websites. One is www.drjoelkahn.com. And then his book website is www.holisticheart.com. I love the title of your book, The Holistic Heart Book, A Preventive Cardiologist Guide to Halt Heart Disease Now. Thank you, Dr. Kahn, for being on the Detox Summit.
Thank you, and it really has been a real honor. It's a wonderful thing you're doing.